I'd like to welcome everybody to the COVID-19 and medical marijuana seminar. This is brought to you by Marijuana Aware. It's one of the first of 17 webinars that we're going to be conducting over the next month and a half. What we're going to be doing is covering a number of lifestyle medical conditions and how medical cannabis can actually help with those particular conditions. We're going to feature various content experts, including doctors. On the call right now is Turner Davis. He's with the medical marijuana treatment clinics, and I'll introduce him in just a minute. But what I want to do is cover a couple of housekeeping issues, if you don't mind, right up front. One of them is that at the bottom of your screen, you'll see a Q&A button. And so if you have any questions, please go to the Q&A button and submit your question. We have people that are monitoring that, and we'll try to answer your question either on the Q&A session or potentially even on this call. But it gives you a chance to give us some information. We're going to use a Q&A for questions, not chat, because that way we can monitor it and we can actually share it with everybody in the group. And again, if time permits, we'll actually answer it during the call. If you need more information about the other seminars that we're doing, the other 16, which next Tuesday we're doing one, and how can medical marijuana help you? If you go to marijuanaaware.com or Facebook, or either our website, Facebook, or Twitter pages, you'll be able to find more information. And what I'm going to point out is that afterwards, after the seminar, you'll get a follow-up email that'll give you a link to all that information. You can be able to find all of that. I'm Marc Matoza. I am working with Marijuana Med today, and I also work with the Marijuana Med, the medical marijuana treatment clinics in Florida to provide the help in the medical marijuana fields. What I'd like to do is I'd like to introduce Turner Davis. Turner is the he's the chief operating officer of MMTC. I've had the pleasure of working with Turner for almost 4 years now, for 3.5 to 4 years. So we're either good buddies or we're drinking mates, one of the two. Trying to figure out which one it is. But seriously, Turner has over 20 years of experience as a pharmacist here in the state of Florida. He's practiced in a variety of settings. That includes retail, long-term healthcare, as well as in specialty settings. Turner's worked in the cannabis industry since 2015. He's both in the production as well as in the provider side of medical cannabis. So he's got a lot of experience here in Florida with the Florida systems, not to mention with healthcare and also with cannabis. What he brings to this particular party is a true healthcare provider's point of view on the medical cannabis space, which is going to be important today. And also he's enjoyed over the last couple of years working with a number of people to help them see the relief they get from using medical cannabis and providing patients. So Turner, welcome to the seminar.
No, thank you, Mark. I appreciate it. You know, it's exciting. It's our first one, so everybody gets to see all the bumps here. Hopefully, we will smooth them out pretty quickly, but we'll give it a shot and see how we do here.
We're going to be very real. I chose my background settings, so we'll see how that all works out.
There you go. Exactly.
So, Turner, let's get right into it. What is COVID-19? And by the way, why is it so dangerous? Why is it so uniquely dangerous versus some of the other things that we've seen?
Well, I'll tell you what I'm going to do here. I'm going to go ahead and I've got a little slideshow that I put together. So let me go ahead and get this pulled up. And
COVID-19, we hear a lot of words about it. I don't think we really, at least from my perspective, I really don't understand exactly what it is and how it's so different and why it's so contagious.
Yeah, no, exactly. Well, I mean, this is something new for all of us, right? I mean, it's we've never had anything like this on this scale before. You know, as a pharmacist, it's both interesting and scary to hear, you know, all the goings on that have occurred because of COVID. But you know what COVID is it's a virus. It's a new virus. It's there have been coronaviruses in the past, which is what a COVID is. COVID is short for coronavirus. We hear COVID-19 a lot. It's coronavirus 2019 is when it was identified. So it's a new virus discovered in 2019. There are other viruses in the family of coronaviruses, including SARS and MERS, and we heard those terms, saw those viruses in the early part of the decade and mid-decade that caused a small scare, but you know those weren't as contagious. So that was really the difference between those and COVID. Those were harder to transmit. So what we have here is something more similar to the common cold, which is also a coronavirus, similar in the fact that it's easily transmissible from person to person.
Cameron, you may want to share your screen. I think you have a screen.
Oh, is it not shared there? Well,
yeah, you're not shared there.
Okay. Let me see here. Share screen. Desktop 2. Oh, I see. I didn't hit the button. Clicked on it, didn't hit the button. So there we go.
There you go.
Yep. So, like I mentioned, it's very easy to transmit, from either aerosolization of particles as you breathe in and out or as you talk to other people. If you're close enough, it's easy enough to transmit that way. It can also be transmitted through contact. So if you touch a surface with virus on it and touch your nose or mouth or other mucous membrane, you could transmit it that way. So again, very similar to the routes of transmissions that we see with the cold. Unfortunately, of course, the symptoms of COVID are much worse and can be much more serious than what we see with the cold, and that's the biggest difference between the two.
So the question becomes, where do we stand? You have some CDC updates. What's their feeling of this whole thing? I know there's a lot of talk about what's safe, what's not safe. How do you know? Do you have it? I mean, I've heard that some people didn't even know they had it when they died.
Well, exactly. That's what makes this so tricky, is that with COVID-19, up to half of the patients that may actually be infected with it don't show any symptoms, and yet they're still contagious. So that makes it very difficult, obviously, to isolate the people that are infected. If you don't know you're sick, then how do you know to stay away from other people? Those people that do have symptoms range from mild to life-threatening. So that the other 50% that have symptoms usually present with, this was the latest list of symptoms the CDC came up with: fever, cough, shortness of breath, chills, shaking with chills, muscle pain, headache, sore throat. And the most unique symptom of this virus, as opposed to some of the other ones that we deal with, like the flu or others, on the mild side, is loss of taste or smell. So patients that have this have often reported that they completely lose their sense of smell and taste. I actually saw an article a day or two ago about the peanut butter test. That's one way they were testing people to see if they were infected and whether or not they could smell the peanut butter when they open the jar. So that's sort of an oddity with this virus that can allow at least some way to tell if someone is asymptomatic, other than you lost your sense of taste or smell. So that's interesting that way.
That's an interesting symptom in it. I don't think that people have really highlighted that before. I know it wasn't until we started doing this that I really saw that.
Well,
that's an important benchmark.
Yeah, well, the caveat to all of this is, we're still learning. With COVID-19, it's brand new. This has never been in humans before, so they're learning as we go. The doctors and the scientists that are fighting this every day are coming across new information every day. So, obviously, it's important to stay up to date on the latest information. But what we have today is sort of what we can go over and discuss. The seriousness, we talked about some of the milder symptoms. The more serious symptoms are obviously when we get into, it's a respiratory infection that infects the lungs initially, and that's where it causes most of its damage. So when we start to get patients that are in serious trouble with COVID-19 is when they have trouble breathing, persistent pain or pressure in the chest, confusion, bluish lips, those symptoms of oxygen deprivation. If you can imagine, if you have someone who just is not getting enough oxygen, these are the similar type symptoms there. And those are the people that are really advised to seek medical attention quickly for those sorts of more serious symptoms that can occur as the damage of the lungs increases.
Yeah, Turner, we had a question, and it might come into play here, and that is, was COVID-19 made in the lab? Do they really know where it came from?
It's really, I don't know if we'll ever know for sure where it came from, honestly. There's a lot of information bouncing back and forth. Certainly the evidence, the more you read, the more it doesn't seem like it was made in a lab. Now, did it escape from a lab as they were researching it? Now that may be possible, certainly. But that again, it's just hard to know, because these viruses are present in nature. I mean, coronaviruses there are a subset of mammals that are carriers of these things. And as humans interact with them, they can get into the human population. So that's something that they're going to have to track down. But again, a lot of times we don't know that for sure at the end of the day what the true origin of these things is. As far as one of the other things that we see in the more severe cases are the as well, one thing that happens a lot of times with these types of illnesses is that the immune system in the body can really overreact to these pathogens. So when we see, well, what they're also finding is not only does the disease itself, the virus, cause damage to the lung tissue, but then when our immune system starts to fight the virus, we can actually do our own immune system can cause damage to our organs trying to suppress the activity of the virus. So they call that a cytokine storm. Now that's, a fancy medical term, but basically what that means is your immune system kicks into overdrive and starts attacking the virus so strongly, so virulently that it actually damages the tissue that the virus is infecting, which can be heart tissue, lung tissue, kidney tissue. So we're seeing in some patients organ damage and very prolonged fevers, very high prolonged fevers because of that reaction. And that's an area where a lot of the treatments are being looked at currently for the more severe patients, is how do we control that immune response to minimize the damage from that.
Yeah, where do we stand on vaccine and testing and all that? Because there's a lot of talk about it, but I'm not sure there's been a lot of, how should I say, clarification.
Yeah, exactly. So the way these epidemiological or these disease outbreaks are contained typically is that you have to be able to test the population to find out who has the virus, and then isolate those people, and then track and trace whoever they came in contact with and isolate those people so that, until the virus passes and they're no longer contagious. Well, the problem that we've run into now is that we don't have a lot of tests. A lot of the patients, like we mentioned, are asymptomatic, so they don't know they're sick. So it's difficult, obviously, to identify these clusters of virus patients and isolate them before they spread it to a larger population. So, that's the reason we're all socially distancing, staying home, doing all the things that are recommended, wearing masks, wearing gloves to prevent that transmission, since we don't know half of us that we're even sick. So what we're left with, if we can't stop it, then we have to be able to treat it. So treatments out there, when we talk about treatments, we're talking about patients that have the virus, that have symptoms, and how do we reduce the severity of those symptoms. And right now, unfortunately, we don't have anything that is proven effective to reduce the symptoms of the virus or treat the virus itself. There are studies going on. There's one recently. I'll speak about the remdesivir that is from a drug company called Gilead. That they have tested. A very positive study came out yesterday or the day before that showed, a reduction in symptoms or reduction in hospitalizations from 15 days rather to 11 days. So that may not sound like a big deal, but it is statistically significant. And obviously, if you're very sick, being sick for 4 less days is a positive thing. So that was a positive outcome. So what that really showed is that they can affect the virus with a drug potentially. So that was exciting to the scientific community. They're also looking at actually interesting study going on with famotidine, which is Pepcid, which is a heartburn drug, but at a very high dose. So that goes back to that controlling the immune system a little bit, is what that's helping. Hydroxychloroquine, we heard a lot about that in the news. It's not really been proven effective yet in these studies, so we're still working towards getting some definitive answers on that. But again, that also goes back to modulating the immune system. That drug is used for lupus and for rheumatoid arthritis to, again, reduce the inflammatory response in the body. And that's sort of the idea behind using it with the virus as well. So, those are just some things out there. But again, eventually we want to get to the ultimate goal of a vaccine, which really is the gold standard of stopping an outbreak. You have to give people immunity from the virus before they're comfortable going out and not have to worry about catching it again. And hopefully, by the latest we heard this morning, trials are beginning. So hopefully maybe by January or the end of this year, we may have a potential of a vaccine with it. So, fingers crossed on that.
Sure. So one of the questions coming up is, how does medical marijuana help in this stay-at-home environment with COVID-19, or just for the environment in general, helping to put up with, say, a lot of frustrated people, myself included?
Well, so the number one thing everybody's dealing with right now, of course, is staying home, being away from our jobs, being around our lovely children all the time. I've got two myself. Fortunately, mine are older, but I can't imagine being homebound with with a 6 and 10-year-old right now. That would certainly drive my anxiety level up. But no, it's we're all dealing with different things, and that's the number one reason that patients are using medical marijuana right now. Legal cannabis use across the United States is at record levels right now. Almost all of the dispensing organizations are reporting record sales, and that goes hand in hand with alcohol sales and other things as well. That's on the rec side, not so much on the medical, but still it kind of shows that patients are using cannabis to deal with anxiety. With increased anxiety comes sleep problems, comes mood and depression problems, which medical cannabis has been shown to do really well at helping all three of those things. So we see therapeutic benefits, but we also see quality of life improvement, mood elevation, again, being able to get a good night's sleep and lower your anxiety level is certainly something patients are using it for a symptomatic aspect of, dealing with the day-to-day of our change in schedules and those sorts of things. Now, when we talk about, cannabis and COVID specifically, when we talk about addressing the virus, there's nothing, like I mentioned before, there is no treatment out there that has been shown definitively to treat the the symptoms or to reduce the severity of the virus that's available to the public yet. And that includes cannabis. We do know that smoking cannabis could potentially increase the risk of contracting the infection because it is a lung disease. And if we irritate the lungs in any way, we can potentially make the body more susceptible to becoming infected. But so this would be a good time if smoking is your preferred route of administration for cannabis. This may be a good time to experiment with some other dosage forms. There's with medical cannabis, there is capsules, there's drops, there's patches, topicals, all sorts of things that all sorts of ways to get the cannabinoids, the medical chemicals of cannabis into your body. So this may be a good time to experiment with some different dosage forms. But again, especially for, and really that's especially for high risk groups. So if you have underlying conditions, or if you're older, or if you have, immunocompromised, it may be a good idea to try a different route of administration. CBD, there's actually, the CBD portion of cannabis, of course, there's the two main chemicals in cannabis are CBD and THC. CBD is the non-psychoactive or non-intoxicating chemical, and it's being studied in Israel. They just started some studies either last week or this week into looking at that as we talked about reducing the immune response or reducing the body's response over response to the infection. And they're looking at CBD and its anti-inflammatory properties, its immune modulating properties really, to reduce the severity of the infection. They're looking at a way to deliver it directly to the lungs. And then also they're doing a study where they combine it with steroids like prednisone to reduce the inflammation in the body due to the virus. So, we're seeing, we'll hopefully get some more information on that sooner rather than later. But, there is some work being done around the world with cannabinoids and cannabis and the response to COVID-19 from the body. So that's sort of an interesting way to present, medical marijuana as a potential alleviation of symptoms there for some of that. As far as the actual direct antiviral, is it toxic to COVID? Those sorts of things. There's really no evidence that you can kill the virus with medical cannabis use. So I wouldn't really hang my hat on that one. But the anti-inflammatory and the immune modulating properties, we see that in other disease states like arthritis, like lupus, and those things that patients do use medical cannabis for. So it will be interesting to see if we can get some positive data from those studies.
So the bottom line is everybody was caught off guard with this thing. So everybody, whether it's medical cannabis related or not, everybody is out kind of doing their studies now. So
Yeah,
unfortunately, we have to have a little bit of patience.
exactly,
Going forward, we have to have a little bit of patience to be
exactly.
able to wait for the right formulas, vaccines, tests, or whatever that's out there. I know it's frustrating, but it's something that's going to be critical to be able to really open up safely.
Exactly, exactly. You know, like I said, we're all learning something new every day about this disease and COVID. So, you know, we'll continue to learn more as time goes on.
So what is MMTC doing? You have 25 clinics. What are you doing to protect your patients and to really protect your employees?
Well, you know, that it is important to us to make sure, you know, at our doctor's offices, you know, we specialize in qualifying patients for medical marijuana. Our doctors do, and you know, it's important to us as a company to make sure our patients are protected as best we can when they're required to come into the clinic for a visit. So we take advantage of all the tools at our disposal. You know, obviously, medical marijuana is a wellness setting, so the patients that come and see us aren't necessarily acutely ill. We're not treating colds and coughs and those sorts of things in our doctor's offices. We're only qualifying patients for medical marijuana. So we want to make sure patients are just as healthy when they leave as when they come in. So obviously, the state is allowing the doctors to use telemedicine in limited ways. So if you already have a card and you're coming back in for a 6-month or 1-year follow-up that's required by the state, if you saw the same doctor before, then you can actually use telemedicine to do that 6-month appointment. So for quite a few of our patients, that's been a great option, and we've had over, you know, several hundred, almost 1,000 now take advantage of that in the month or so that it's been allowed. So that's been great. We also allow curbside check-in. So that means, you know, you can drive up to the office, give us a call. The staff will come out, get you checked in the car. If you choose to wait in the car, we'll let you know when the doctor's ready to see you. So you don't have to sit in the waiting room the whole time. Sanitizing the office obviously is very important. We do that several times a day to make sure any virus that may be lingering around is taken care of with sanitizers. So those things are really, you know, as well as the mask that our staff wears and the PPE, you know, that all of our staff wears to protect the patients as well. So, you know, the dispensaries are doing something very similar. So, you know, as far as when you actually go to purchase the medication, those guys are limiting the number of customers in the store. They do home delivery. They offer curbside pickup. You know, of course, at their production facilities, they have protocols. So, you know, all of the medical cannabis industry, when we found out that we were going to be an essential service and that we had to remain open, we certainly put in place protections to make sure all of our patients were well taken care of there.
You know, Turner, a question came up from a gentleman who's new to the treatment, and he asked, how do the doctors become certified in cannabis?
So the doctors in Florida, they really honestly don't have to do a lot of background work to become qualified. So if they're an MD or DO, so for those of you who don't know, there's 2 types of degrees for doctors. You can get a medical doctor or a doctor of osteopathy. It's the same, essentially the same, just 2 different things. But if you're an MD or DO, then you can become a qualified physician to recommend cannabis. You know, ARNPs can't do it, PAs can't do it. It has to be a doctor that qualifies a patient for cannabis. All they have to do is take a 2-hour course provided by the state, which basically goes over the rules of cannabis in the state of Florida. So, you know, the advantage of using, you know, so, you know, again, any doctor could do it. Most doctors don't really want to mess with it too much because it is a lot of paperwork and is a lot of time you have to spend with patients to make sure they understand how to use it. So if you have a busy practice, you know, a busy primary care office that's seeing 30, 40, 50 patients a day, obviously they probably don't want to add this necessarily to their line of services just from a workflow standpoint. That's sort of how it's developed in the States. So, you know, so these specialty clinics like MMTC and others have popped up that really allow the doctors to focus on the medical cannabis side of it, become experts, and be able to answer questions about dosing, about those sorts of things in Florida. Because in Florida, unlike a lot of states, the state really requires the doctors to stay involved. You know, in some states, if you go to the doctor once, you get a card, and then you're good to go. You really don't have to interact with that doctor again. But the state of Florida requires that the doctors maintain your orders in a state database and registry. They require that you're seen every 6 months, and then the doctors, renew your orders every 6 months. So it is more of a traditional patient-doctor relationship than it is in some other states. So it is important to be able to reach that doctor, ask questions, and understand how to use your medication.
That's an important point, because a lot of doctors take the 2-hour test from the state, get their state certification, and they hang out a shingle, but they may not necessarily know about medical cannabis. I know I'm talking to a lot of doctors myself. That's one of the questions they have, is where can they find out more information? I think one of the advantages of your clinic is I know you and Cameron and your folks do a lot to try to train the doctors as well. Provide them a library, and also provide them a training information to keep them up to date on what's going on with medical cannabis, versus being by yourself in an office.
Yeah, no, exactly. Well, that's the big advantage of being, for the doctors, of being in this group setting, is that, overall as a company, we've seen, tens of thousands of patients. So they have a lot of information to pull from to know what works and what doesn't. And that really is a big advantage over trying to start from scratch with every patient that comes in the door. So.
Yeah, I think that's a big advantage. That also reflects in the dosing. I should point out, you also do dosing support, which I think you're the only one of the few MMTCs in Florida that's able to do that.
Yeah, absolutely.
And that's critical to really getting it right. Where can you learn more information? What resources do you have there?
Well, let's see. I think my screen just went out there. There it goes. So I've got a couple of links here. If anybody's interested, to the CDC and the FDA for their COVID pages there, they have some really good information, as well as the state of Florida has a dedicated COVID page on their at the Department of Health website with the most updated information. And then at MMTC, we have our own information COVID page there that relates a little more to the cannabis industry. So if you're interested, I urge everybody to check that out as well.
Yeah, by the way, I should point out that these links, after this session, you'll get an email, and that email will have these links on it, plus the capability to download patient education brochure, which is great for being able to find out information about how medical cannabis works. And then also that patient education brochure has some discount coupons in there if you do decide to become a patient. What they'll do is it lets you be able to get discounts from the dispensaries that are up there. So basically, I think that's a lot of what we were gonna cover. I know, like I said, as a follow-up, you'll be getting a lot of information. One of the questions that somebody asked me is, what's the difference between COVID-19 and the coronavirus?
Yeah, so it is confusing. We hear both terms a lot. So, like I mentioned earlier in the presentation there, the COVID-19 is a coronavirus. It is just a one type of coronavirus that is out there. When we talk about COVID, that again, COVID is short for coronavirus 19. So it is just a subset of coronavirus that there is several of. So.
Well, that's cool. And by the way, are there any studies going on right now with medical marijuana and for medical marijuana to be a vaccine? Is there anything like that going on?
No. It's So like I mentioned, there's very little evidence that medical marijuana will affect the actual virus itself. I mentioned, there are potentially looking at it as a treatment to reduce the severity of symptoms, but we'll find out more when Israel finishes the studies they're doing. I don't know of any studies that are going on in the U.S. With CBD and COVID, but I know those in Israel started this week. So.
Yeah, I think there are 3 studies out of Israel, which doesn't surprise me.
Yeah.
That's I know it doesn't affect COVID-19 or coronavirus directly, but I can tell you all the things around it, like anxiety, stress,
really.
Just being able to live on a daily basis, getting your body healed and well to be able to help fend it off. I think that shouldn't be underestimated. That's very important.
No, absolutely. When we're talking about, self-care, taking care of yourself, keeping your immune system up to snuff there, a good night's sleep, rest, being able to rest, keeping your mood elevated, keeping your appetite good, all those things cannabis can really help with on that side of it, for sure. So.
Yeah, no, joking, my wife and I were saying that, thank God we're compatible, because this is a test of your marriage.
Yeah, absolutely.
If you have a problem, you're going to find it out right now. So it's there. Anything else you'd like to add, Turner?
No, nope. I think that's it, man. I appreciate the time today, and hopefully, we can improve on these as we go, and look forward to doing the next one.
And I think anybody who's interested in the medical marijuana treatment clinics can help you get your card here in Florida. Be able to go from there. So that'll be important. So I'd like to wrap this up and thank everyone for attending. We really appreciate it. Hopefully we answered your questions that's out there. This is a touchy subject right now. It's one that's, how should I say, highly controversial. And I think it's important to understand what medical cannabis can and can't do in this particular environment. So Turner, thank you very much for your time. We appreciate it.
Yeah, well, no, that's good. Well, hold on, Mark. I think they said we had one last question here.
Oh, do we? Okay, great. Okay.
That was yeah, I'm looking at it. How would medical marijuana affect my pain management program? So yeah, we get that question a lot as we go around and do these different presentations. So most really every pain management facility or doctor has their own policy, but the vast majority at this point do allow medical marijuana as long as it's prescribed by a physician. But it's just something you want to check with your pain management physician to make sure it's not against their policy. There is no state rule against it. It's just individual doctors, how they view it and what their individual office policy is. So.
Yeah, I know I use it for pain management, and I can tell you it works. But again, it depends on your physician. My physician was initially against it, and then as he saw the progress that I was making with it, he actually is very much for it. Of course, we've been working together for over 2 years on this, so it's been a transition on his learning part on his part. I guess I was his guinea pig. I don't know.
And that's what we see with most pain management doctors. Once they, in the early days, they were very against it, but then as they saw their patients improve, we see much less pushback today than we did. So.
Yeah, and I can tell you, I don't have all the symptoms from. I just say the side effects from a lot of the prescription drugs. I'm not anti-prescription drugs. It's just I prefer not to have the side effects during the party.
Exactly.
That's all.
All right. Well, thank you, everybody. We appreciate it.
Thank you, everyone, for attending. And like I say, you'll be getting an email follow-up providing you more information. And we thank you very much for your time. Next Tuesday, we're doing another broadcast. It'll be on how medical marijuana can help you. And then next Thursday, we'll rebroadcast this COVID-19 broadcast once again. So please tell your friends and invite them. So thank you very much. I appreciate your time.